Okay, good morning. Dr. Ryan, are you there?
I'm here. Thanks, Mark.
Okay, I don't know what's going on with our equipment, but I had to reset a squawk box, but here we are, nevertheless. And thank you for joining us. I know you're a busy guy. I'm glad that you can find time to squeeze us in once in a while. I wanted to get right after this vaccine distribution here in Clear Creek County. And the first thing I want you to know is that I spoke with a person who had been on that very first list of over 70. She was vaccinated this past Friday, and I'll paraphrase what she said to me. She said, I am like most people, I'm always looking for a way to complain, but I have to say that was an incredibly smooth process, and everything went so efficiently, and she had nothing but praise for all of the people involved in vaccine distribution. And I just am so very proud of our county and all the work that you and your staff have done to bring this to fruition. And I heard you say that you could vaccinate 1,000 people a week if you had the supplies, and I truly believe that's the case. So thank you for all your hard work.
Yeah, I appreciate that, Mark. It's great to hear words of encouragement like that. Our team is incredibly efficient and effective at what they're doing, professional to say the least. And I think last Friday's vaccination clinic showed that in spades. We've received several of those via email and phone calls, so it makes us want to get up the next day and continue on and do what we're doing. And it drowns out those that want to complain. I would ask everyone to be patient. We will vaccinate everyone in the county who wants a vaccine. It's just a matter of time. We are receiving vaccines in very small batches, and so we can only vaccinate so many people a week. This week, as an example, we didn't receive any vaccines for first rounders, so we're unable to have a vaccine clinic this week. And so moving forward, we would ask everyone to be patient. We will vaccinate you as quickly as we possibly can. We'll do it in as professional a manner as we possibly can, and make sure that everyone gets one that wants one.
Now, I thought I heard Suzanne reference some other process for registering to be in the queue for vaccination. As of right now, do people still go on clearcreekcounty.us and hit that link for the registration page? Is that still the process?
It is the process. We would ask, though, that only people who are in that group that's going to be vaccinated to do that. That includes individuals who are 70 years of age and older, and those individuals who are in Tier 1A, 1B. Those include law enforcement, EMS, fire, and healthcare workers. We are actively trying to enroll those folks. If we are inundated with a bunch of people who don't fit in those categories, we spend a lot of time and resources trying to sort through everybody and determine who should be getting vaccinated. So if it is not your turn, if you're not in one of those groups, please do not go on the website and pre-register. You will be alerted via radio and phone and et cetera, when it is your turn as a group to get vaccinated. We will let you know. And the form is online. We're in the process of updating it. We sort of learned through the first week some things that we might want to include. So we're now making those changes, and that is the process. They get pre-registered. We then go through that list and vet that list to make sure that individuals are supposed to be on that list. And then as we receive vaccines, we will then begin the scheduling for that next week. But like I said, some weeks we get vaccines and some weeks we don't. So we don't know yet what next week is going to look like. As soon as we do, we will contact those individuals, reach out to them that are in the queue, the next 100 or 200 or whatever it is, and get them scheduled and get them vaccinated.
Okay, I have walked through that process. You go on the county website, you click on the link for the registration page, and it was last week when I did that, and so I don't recall, but I heard you say something about out-of-county residents trying to register on that site, but I don't remember there was any place where you could check a box that I am a county resident. Maybe that's one of the changes that's being suggested.
Yeah, that was changed this week. It is one of the questions now, and it may be further changed as we move forward. But we're challenged with a number of people from other counties reaching out and wanting to get vaccinated. County allocation is based on the people who live there. So if we get half of Jefferson County, wanting the vaccine, we're not going to receive from the state enough vaccines to vaccinate half of Jefferson County. If we did, we'd be happy to vaccinate half of Jefferson County, but that's not reality. So we're having to sort of move through this process as we go, and things are coming, changes are coming from CDPHE and their guidance on how do we do that specifically. How do we include or exclude people from different counties, residency requirements, those sorts of things. So we have an opinion on it, but we're waiting for CDPHE's opinion so that we don't come out with one and then we are given guidance from CDPHE that's opposite of what we have thought about. So we're waiting for them to come out with guidance, and we're going to continue as we are to vet people as we do and then move forward from there.
Well, it seems as though it's a logistic nightmare when you consider trying to vaccinate close to 300 million people in 50 different jurisdictions, statewide jurisdictions, not to mention 3,000 plus counties across the country. It's just a logistical nightmare that needs to be organized in some more coherent fashion. I heard you make reference to this. I have high hopes that with the change in administrations, we will see that a streamlining of the process coming pretty soon. Until that time, I think people just have to get on there, register if they are eligible for registration at this time, and just wait for that notification, right?
Absolutely. We would ask that you wait. We don't want to spend our time trying to vet people out who aren't yet qualified for getting the vaccine. So we'd rather spend our time disseminating those vaccines and moving forward. So please, if you're not in the 70-plus group or a Tier 1A or 1B, do not pre-register. We will let you know when it is time to pre-register. Right now, we have 600-plus people on the pre-registration list already that we're having to go through and vet and make sure that they are who they are and we're vaccinating the right people.
Well, at least we've had that a terrific first response. I'm gratified to hear that. Dr. Ryan, I don't mean to set your hair on fire, but I'm not sure that you're aware of this. I just read this myself just prior to the update to the county. But Axios News is reporting and confirmed by the New York Times that the CDC is going to change their recommendation from 75 plus to 65 plus eligible for the vaccine. They are going to expand the venues where people can be vaccinated, and they're going to release all the available doses for first person inoculation. I don't know what this means to the county process, but I'm sure there are going to be implications going forward.
Absolutely, Mark. And I eat about a pound of salt a morning before I start my day so that I can take a grain of salt with everything I hear. We're going to be vaccinating as we receive vaccines, whether they change it to any age group at any given day. We don't want 65-plus people right now registering. We don't have vaccines for you. So getting into a queue a month or month and a half before we can actually practically give you a vaccine makes zero sense. It just increases people's frustration. So I would recommend right now to adhere to the guidance that I am saying. If you are 70-plus, register. If you are in 1A or 1B, register. Everything else is a bunch of noise. I don't have the vaccines to give to people in those age groups yet. So until we receive them, that guidance really doesn't mean anything to us because we cannot act on it. It may be an attempt to create further chaos in this country, which is not shocking. But we are going to disseminate vaccines as we receive them to the appropriate group that we have. When we get done with the 1A and 1B and the 70 plus, we will move on to the next group in line. But until that time, to be frank with you, it doesn't really matter what the federal government says or recommends at this time. We can only do with what we have, and we're going to do that moving forward.
I'm glad to hear you say that because my first impression was this is a cruel twist to even suggest that folks 65 and up can receive a vaccination when they can't even accomplish the vaccination of critical first responders. Let's move on. I wanted to ask you what you might know about any news that's out there about the length of immunity that might be ahead from either of the vaccines that have been approved for emergency use. I know that's still in the news, seems to be there's some vague reference, but there isn't any substantial information. I just wanted to quickly ask you if you had anything in the way of an update.
I don't, Mark. I know that the companies, Pfizer, Moderna, et cetera, are actively following that and looking at that. And so I have not, that's where I would personally get my source of information from. I wouldn't rely on the news or any other source. Once those companies have a definitive answer to that question, then they will put that out through the CDC or some other agency. So I have not heard anything official. Excuse me. When I do, I will share that with the public at large. Until then, we do know that this vaccine is effective when taken in 2 doses, in the Moderna 28 days apart. So it's critical if you do get that first vaccine to get the second one. The first one only gives you so much protection. The second one gives you far more. So it's critical that you get those 2 and the regimen that is guided and move from there.
Speaking of the second dose, I was wondering, because of the uncertainty around vaccine distribution from the federal government through the state to us, is that a critical hard date for the folks who have received their first dose to receive their second dose? And what are the implications if people don't receive their second dose in a timely manner?
Mark, great question. That is recommended, and that is what we're doing. Trying to accommodate everyone's schedule is not logistically possible, nor are we going to entertain it. It's just not possible. So when you get that first vaccine, your second vaccine will be 28 days between there. So depending on the day, it'll be 28 days between the first one and second one. Your second visit will be scheduled. And when we reach out to schedule people for their first one, that's the question we ask. Are you available on this date, which is 28 days later? If their answer is no, I have plans, then we tell them, well, then we're not going to give you this first one. You need to be available for both. It's absolutely important from a logistics and scheduling perspective. From a clinical perspective, is there some wiggle room? Yes, there is wiggle room, and I very hesitate to tell you that because we want and need people from a logistical perspective to not suddenly request us to accommodate their busy schedule because we don't have the ability to accommodate that. So we're asking that people come back on their scheduled date, and it would provide us with way too many headaches to try to accommodate any other way.
Well, it just seems to me that if you were one of the fortunate few who have received a vaccination, it's your obligation to get back in there as scheduled, and that's of course based on availability of the vaccination from the state. And okay, I wanted to also ask you about this British variant of the virus that has been spreading across the world throughout the United States, including Colorado. And can you give us a description of what the implications are for spread of the COVID-19 by this variant?
Absolutely, and I would imagine there's other variants in America already. We very well may have our own variant, just given the sheer volume and number of cases that we've had here in America and for how long we've had it. We lead the world in that scenario, so we probably have our own variant that we're not yet aware of. The UK variant that you speak of, what we do know is that it is far more, much higher level of transmissibility than the original COVID. We don't know exactly how much more, but the current estimate is between 40 and 80% more transmissible. What does that mean? It means that you can have a jump in number of cases that absolutely explodes in a week or 2 weeks' time. Where it would take much longer from the previous iteration of the virus, the original one would take. So it has a huge implication as far as case counts goes. We do know that it is not more fatal than the original, so that's good news. The other good news is we also know that it is not immune from the current vaccines that we're administering in the United States, the Pfizer and Moderna. They're good pieces of news. The downside, as I said, is that it is far more transmissible, so cases can spread much quicker, much further than they already are. And right now in America, as I said on the call earlier today, our case count is absolutely through the roof. We lead the world, 250,000 plus cases a day in America, and a variant like that could easily double or triple that number within weeks. Which would absolutely be devastating for this country, which set us back significantly. So all the more reason, wear your mask, socially distance, do not have social gatherings, and stay 6 feet apart. We do know that there is a significant uptick in this state and across the country from Christmas and New Year's. The public health guidance was not abided by too many Americans, and so we're now seeing that in spades, and our numbers going straight up. 5 days after Christmas, there's a significant spike that goes straight up and continues on as we speak. So we do know that people are having a hard time following the guidance, and with that variant, it could be absolutely disastrous.
Well, I've been trying to imagine in my mind. I read that the R0 for this virus variant was estimated to be 1.45. That's a crisis number. I try to imagine what that means to be 50 or 60 or 80% more transmissible. And I think in terms of mask wearing, that we all have this psychological safety net of in addition to the physical barrier of the mask. And it seems to me that if it's 50% or 60% more transmissible, that's as though we're all not wearing masks. And that's how much more likely it is to spread, even with a mask on. So, the distancing becomes even more critical, doesn't it?
It does, and that's a great analogy. We're going to continue the need to wear masks and socially distance for the foreseeable future, vaccine or not. The other point I wanted to make about the vaccines is that receiving a vaccine does not preclude you from wearing a mask now or socially distancing or otherwise. It merely provides you, the individual who's received that vaccine, a level of protection at the 90-95% rate. There's still a chance you can get the virus, and if you're not wearing a mask, you certainly can still give the virus to others. Granted, it makes that window of transmissibility from a vaccinated person to non-vaccinated person shorter, but it's still there. So it's all the more important that you continue to wear your mask, socially distance, etc., even once you've received the vaccine. we're not out of the woods yet, not even close. So until we can get enough people vaccinated and enough people follow the public health guidance, and thank God there's no major holidays coming up, we can abide by those guidance, and we can potentially change the curve in this country. Included in that is obviously the national plan that's forthcoming that we've talked about.
Well, it's been a maddeningly slow rollout of the vaccine so far. Very understandable, considering the tremendous logistical problems of distributing a vaccine to so many people in so many different places. But until Dr. Fauci gives us the stand down, I would say that mask and social distancing, hand washing, and all the other measures that we've taken to try to protect all of our loved ones from us and everyone else, we are going to have to continue with those. I wanted to finish with one more thing. I heard you mention contact tracing on the radio when you were speaking to the county commissioners, and I was frankly kind of surprised that we're still engaged in that process, seeing how the COVID-19 has exploded across the country. Most jurisdictions have just given up trying to trace, but we're still in that process.
Absolutely. It is one of the foundations of epidemiology is to contact trace, identify cases, isolate those folks, identify their contacts, and quarantine those folks. It's the best way to stop the spread of the virus. It's critical that we have that information, and we are, as you said, one of the few counties continuing to do that at 100% rate. Many counties have abandoned it altogether just because of sheer volume. But we're continuing to do 100% of cases and contact trace. The challenge is our level of cooperation from cases has significantly decreased. That's a problem from public health perspective. If you do not provide us as a case your contact information, it makes it very, very difficult or impossible for us to identify your contacts, reach out to them, quarantine them, etc. And so what happens is if we don't have that information, we're blind, and we can't see the cases that are coming. We can't see the potential exposure that's out there and put a stop to it. That's one of the tools in our toolbox. And by not sharing that information with us, you're taking it away from us as a tool. And I'm not sure you want to do that as a community to public health, creating a situation where we're blind and flying blind. We need that tool. So I would ask and request everyone, if you're contacted by public health, please provide them with as much information as you possibly can. You do know who you've come into contact with, so suggesting you don't know is a disservice to your broader community. If you want restaurants to continue to stay open, you want our community to open up, it's critical we have that information, particularly moving forward. Once we have enough people vaccinated and we're doing case contacts, it's our only way of mitigating and reducing the number of cases in our community, even more so once people are vaccinated. That's the plan moving forward. Once we get our most critical people vaccinated, in isolating and quarantining those who've been in contact can help us put an end to the virus in our community and more broadly in the state and in the country. But when you don't provide that information, we're absolutely blind. And right now, the last people you want blinded is public health.
Yeah, I would just say that people have to really understand that public health is just exactly as committed to your privacy as your own personal physician is. When you go to your personal physician and you share that most intimate of information with that person, you do so with the assurance that information will not be shared unless it's necessary for your care. And that's the same with the Department of Health. You guys are not putting that out there to anyone.
Correct. Absolutely correct. Your information is kept to those who need to know. It's on a need-to-know basis, and there aren't very many people who need to know. So that circle is quite small. I would agree with you. It's the same as you going into a physician's office and relaying to them a medical ailment you're having. We're not going to share it any more than they do. They share it with those people who need to know, the nurses and other staff, and it doesn't go beyond that. We fly in the same. We're in the same lane as that level of care and that level of understanding and information is highly protected.
All right, I just have one last question for you, Dr. Ryan, today, and it has to do with those folks who have contracted the virus themselves. I know a number of people who have had the COVID, and they feel as though they are safe and that they can socialize and that they will never get the virus again and that they have immune protection. What are your thoughts?
That's a problem. So individuals who've had COVID, we do not know how long their antibody response is going to last. It's highly dependent on the individual. It's highly dependent on the level of virus they were exposed to, a whole host of variables. It could be anywhere from 6 weeks to 6 months. So they're taking an immense gamble, not only with themselves, but with the broader community. Getting COVID and getting through COVID is not a get-out-of-jail-free card. It does not allow you, it does not suggest to you that you can ignore all public health guidance. Public health guidance, by sheer definition, is about the public and the health of the public. It's not about your individual decision-making or individual rights or your individualness. It's about protecting the health of the public. And so if you have had COVID and you've gotten through COVID, you need to abide by the same public health guidance as everybody else. The same is true for, as I stated previously, for those who've been vaccinated. Those who've been vaccinated have a much higher level of protection, I would argue, than anyone who's had COVID. And so my suggestion that they need to abide by that guidance is the same is true of individuals who've had COVID. It's your responsibility to help protect the broader public. And doing anything other than that is irresponsible and gross negligence, and you should not be having parties and getting get-togethers just because you've had COVID. Your potential is there still to get it again. We do know that, and your also potential is there to potentially expose others.
All right, Dr. Ryan, thank you for that. And I want to give you an opportunity to address any other issues that I may have overlooked that are on your mind.
I got a lot on my mind, Mark. I don't know if we could cover it on the radio. I think, as I've stated, continue to state, please socially distance, wear masks, do not get together with friends and family. We're at an absolute critical juncture in our country, in our state, and in our community. Cases are on the rise, all due in part to people getting together at Christmas and New Year's, despite the guidance. And so if we really are serious in this country and in the state and in our county of turning the corner on this, it requires everybody's effort to do what is right, to abide by the public health guidance as a community. It isn't about your individual rights. And so, please, do what we ask, and we'll get through this. And if you are in line to get a vaccine, we will get you a vaccine. When it is your turn, we will let you know. But please be patient. Our staff does not have time to contact angry people because they are frustrated with the process or frustrated and tired of waiting. Trust me, we get it. We get it better than anybody. We would vaccinate everybody tomorrow if we could, but we can't. So we're going to vaccinate people as quickly as we can. As quickly as we get vaccines, we're getting them out, and we're going to continue to do so and work our way through the community. We will get through this, but it's going to continue to take patience. It's going to continue to take a commitment to abiding by the public health guidance that we put out. If we're interested in getting through this, it's going to require all of those things on everyone's part.
All right, Dr. Ryan, thank you so much again for all of your work, and thanks to your staff, all of the first responders within our community who have made such a difference. And I just want to leave everyone with this thought, that if you look at a map around the county, we are surrounded by much greater incidents of COVID-19 than we are here in Clear Creek County, and that's a direct result of the hard work of our Department of Health and first responders and all of those involved in keeping us safe. Let's all do our part. Dr. Ryan, thank you so much for joining us today. We'll speak to you soon, and I guess probably by the next time we speak, there will be a new administration, and maybe we'll have some big news out of Washington. Let's hope.
Thanks, Mark. I appreciate that. Have a great day.
You too. Bye. All right, everyone. That was Dr. Timothy Ryan, Director of the Department of Health here in Clear Creek County. And so, as you heard, there are vaccines. There is a schedule. There is a process. If you are of the age of 70 or above, if you are a first responder living in the community and working in the community, then please go on the clearcreekcounty.us website and register yourself for a vaccination. There's 900 and some folks on that list right now. Who knows when those they'll be able to accommodate even those folks, but the sooner you get on the list, the better off you'll be. Everyone else, please be patient. Even those who have been vaccinated or are in the queue to be vaccinated will still have to abide by all of the rules of social distancing, mask wearing, until this thing is resolved sometime later this year. So hang in there, be patient. It's been a long haul, but there is progress being made. Until next week, please be safe.